On the economic front, the Federal Reserve has drastically increased its efforts to save the American economy, announcing yesterday $2.3 trillion more dollars aimed at small business. But that might not be enough of an assurance or a reassurance for the 6.6 million new Americans who filed for unemployment insurance last week, or the 6.6 million from 2 weeks ago, or the 3.3 million from the week before that. This graphic, now this is an interesting graphic because the thing that the right line you see on the right side isn't part of the graphic. That's actually the spike. This goes back to 1970. Take a look at where initial claims have been from 1970 to 2020, and then take a look at the right side of that. We've just never seen numbers like this. It shows just how severe and unprecedented those numbers are in modern times. I want to tell you about what Speaker of the House Nancy Pelosi has been saying in public, and she's been saying what more and more people are saying behind the scenes.
We could have a depression because so many people are out of work, and that's why we have to get the system really energized and working. Let's get out those unemployment checks. Let's get out those direct payments.
Meanwhile, the novel coronavirus pandemic has left our nation's medical stockpile nearly depleted. Despite his own widely criticized response, President Trump is threatening to withhold funding from the World Health Organization, saying the organization has gotten, quote, every aspect of it wrong. Now, it's worth noting right now that the World Health Organization, whatever you think of it, and whatever criticisms exist, declared a global emergency 1 month before President Trump proclaimed that the disease was very much under control, and 6 weeks before Trump declared his own national emergency. The World Health Organization has responded to Trump saying, quote, now is not the time. President Trump has no public events scheduled for today, and as of now, there isn't a coronavirus task force briefing scheduled either. Joining me now is internal medicine physician Dr. Lipi Roy and professor at Princeton University and chair of the Department of African American Studies, Eddie Glaude Jr. Both of them are MSNBC contributors. Lipi, where are we in the arc of this thing? Something that you've been talking a lot about is fatigue and stress from those who are on the front lines. It's now been over a month that there have been people who are working several shifts in a row, 7 days a week, sometimes without the necessary protective equipment. The White House continues to tell us there's enough of it going around, and you and other doctors continue to tell us there isn't.
Good morning, Ali. It's good to be with you. There's so many concerns on so many different levels. Here on MSNBC, we've had a string of healthcare professionals on and saying the exact same theme, which is inadequate protection for the frontline doctors and nurses and respiratory therapists. And this is really key because it's these frontline healthcare workers that are exposed to the most highly infectious men and women. So and they're in close contact. There's no such thing as physical distancing when you're in the hospital. You can see from all those screenshots and those live images in the hospitals, in these ICU settings, you have to be very close to take care of patients. And so that's why it's critically important to have the appropriate protective equipment. So that's on that side as far as the healthcare workers. And we've already talked about the rising rates of burnout and how burnout was a problem before this epidemic. It was an epidemic amongst healthcare workers, clinicians, doctors. It's only going to skyrocket as this pandemic progresses in this country. And then remember, Dr. Fauci said either yesterday or the day before, when the projection of deaths decreased from 100, 200,000 to 60,000, which, by the way, is still an egregiously high number. He said that those projections changed because the model is hypothetical, but the data is real, right? So we have to constantly readjust day by day, if not hour by hour. And that remember, that 60,000 number is contingent upon all of us practicing physical distancing, the hand washing, the covering our faces, all of these preventive measures are critical to keep the numbers at least at a plateau and hopefully at a downturn.
Eddie Glaude, you wrote in the Washington Post on April 6th that these numbers are uncertain, just what Dr. Lipi Roy said. The numbers are uncertain, but mass death is at our doorstep. If we do everything right and shelter in place, we may still see between 100,000 and 240,000 dead. These are staggering numbers, but more importantly, they are real people, mothers and fathers, uncles and aunts, daughters and sons, friends, people whose death will disrupt the lives of families and rend the fabric of communities across the nation. Those who survive this madness will have to figure out how to live together in the company of grief. So even if the new numbers suggest 60,000, we're at 18,000 right now, so that's a triple. There's nobody we know, Dr. Roy, Eddie, you, me, there's nobody who doesn't know somebody who has now lost somebody to this illness. And Eddie, this is our new normal. So when we talk about getting back to normal, we're not just talking about the economy. We're talking about a post-disaster world.
You know, Ali, first of all, good morning. I think you're absolutely right. Look, when Donald Trump talks about opening up the economy and emphasizing that that's who we are, it reflects who he values and what he values. What we do know now is this. When we see this kind of mass death, people are grieving, and they're grieving in particular sorts of ways, Ali, because their loved ones at many times are dying alone. They can't be there with them. They can't tell them that I love you. They can't run their fingers through their hair. They can't hold their hand. And so we know that there's the grief surrounding ordinary death, but then there's the regret, the debilitating regret that often surrounds death. And that is that I wasn't able to be there. I wasn't able to resolve that argument. And so moving forward, who we are will fundamentally change because we're experiencing death in this way. And it's not an individual, private matter. This is happening on a collective level, as particularly when we see these mass burial trenches, when we see these morgues, these makeshift morgues. This is happening in the public's eye. And so we have to address this, I think, directly, because how we grieve now will determine or in some ways impact how we heal. And I think we need to understand that.
You know, you talk about mass burial trenches. There's one here at Hart Island in the Bronx. It is truly unbelievable to see coffins being put into trenches to make space for the newly dead. Dr. Roy, for people who do know someone who has become ill with this, can you explain to me whether COVID-19 causes viral pneumonia or whether it causes acute respiratory distress syndrome? What's the process here that we have to heal that causes people to need to be in ICU and causes them to need ventilators? Yeah,
I'm glad you asked that, Ali, because I think people sometimes get confused. We're talking about terminology, medical terminology that most of my profession we're used to talking about, but the general public, it's maybe a little new to them. So the vast majority of people, let's be really clear, the vast majority of people who get COVID-19 experience mild symptoms. They'll get better, resolve on their own. But for those who require hospitalization, they're developing symptoms, respiratory symptoms that require a higher level of care. You know, symptoms might start off with a fever, a cough, difficulty breathing. The vast majority who then go on to require ventilation or at least ICU level care, they're developing viral pneumonia most often. And pneumonia is really when the air sacs or the alveoli of our lungs fill up with air, sometimes even pus. If it's, like I say, a bacterial pneumonia, this is a viral pneumonia. And so when the air sacs fill up with fluid, it becomes very difficult and painful for a person to breathe. Now, ARDS, however, as you very astutely pointed out, it's acute respiratory distress syndrome. That is a life-threatening lung disease, respiratory disease. It's not an infection. However, the leading causes of ARDS are often infection or trauma. These are people that are usually so sick, they're already in the hospital. And we actually don't have treatment or any type of a cure for ARDS. The management for ARDS is supportive. In other words, we give medications like diuretics to remove the fluid from the lungs, and then when required, mechanical ventilation to support their breathing. It's key to point out, though, unfortunately, that ARDS is associated with a really high mortality rate, as high as I think about 30%. That said, we have been seeing people come off the ventilator and get better, but those are the clarifications to be made.
Dr. Lipi Roy, thank you for joining us. Dr. Lipi Roy is an internal medicine physician. Eddie Glaude, please stick around. We're going to see you again in just a few minutes.